So first of all, folic acid, if you are above 30, take folic acid twice a day instead of once a day, because the chances of congenital anomalies, as I told you, is more. So this is one important thing. And all the screening tests during the pregnancy should be done at a proper time. Suppose if 11-week scan has to be done for Down syndrome screening, it should be done at that particular time and you're not supposed to miss it. And then they should get their all BP checked at a regular interval, because they are more prone to develop hypertension during the pregnancy. And even their sugar levels should be checked at a very frequent intervals. And there is a test called OGTT. That is a test where we give pregnant women 75 grams of glucose, and then after 2 hours, we check their blood sugar levels. So that test needs to be done for every pregnant woman who is more than 30 years of age, because that tells us that whether they're going to develop diabetes or not during the pregnancy. So these are the few tests which everybody needs to get done if you're more than 30. And there's a quadruple marker, which is again a blood test, and it's a screening test for all other congenital anomalies and not only the Down syndrome, like trisomy 18, 11, and all others. So that test also needs to be done. And even there is something called as ultrasound of the fetal heart that is done at 23 weeks of gestation. That should be compulsory for them, because there are a lot of heart anomalies which are not being picked up on the regular ultrasound when we do the fetal anomaly scan at 18 to 20 weeks. So they should get it done, because when the women is more than 30, 35, they are more prone for, fetal heart problems. So that's also very, very important. And when the women is more than 30, the chances of abortions are also very, very high, because the levels of progesterone in the body are low because of the more age. So to support the pregnancy, they should take extra progesterone, and they should be very, very careful with the pregnancy and take all the measures to prevent miscarriage. They shouldn't travel during the first 3 trimesters. They shouldn't lift any heavy weights. They should stop exercising during that time. But slowly, whatever they were exercising previously, continue with that. But first 3 months, decrease a little bit, and from the second trimester or third trimester, they can carry on with their regular activities. And next important thing is that weight gain is very, very important. As you said, that mindset needs to be changed, because as they are more prone for hypertension and diabetes, even they shouldn't gain more weight. It should not be more than 8 kgs, whatever is their pre-pregnancy BMI. So these are the few precautions which they need to take when they are pregnant and if they are more than 30 years.